The Rise Today Inspirational podcast is brought to you by two relentless health warriors, Dr. Erica Harris, an empowered mindset health expert who is the passionate founder of RiseToday.com, and Megan Hubner, an entrepreneurial marketing strategist and founder of meganhubner.com. These two inspirational forces have truly thrived through adversity and are here to empower you to do the same. Together, they serve to open up the conversation about hardship and to move you to greatness through your adversities. Learn more at risetoday.com/podcast. Now, let's get started. Let's rise today, right here, right now.
Welcome back, Risers. Dr. Erica Harris here with you today with my incredibly amazing co-host, the lovely and wonderful Megan Hubner. Hello, Megan.
Good morning, everyone.
Good morning.
You guys are off to a
Good morning.
great day. Hello, nice to be here.
We are super excited to launch this episode where we will open up the conversation about sexless marriages. But first, Megan and I hope you found true inspiration and tools to stay the course and thrive through adversity through Heidi Perro's raw and inspirational story, where she opened up the conversation about rectal cancer and adapting to her life as a young and vibrant woman living with a stoma. And today we are honored and humbled to welcome the host of the CKNW Sunday Night Health Show, Maureen McGrath, a registered nurse who serves as a sexual health expert and who has served a powerful TED Talk titled No Sex Marriages, discussing masturbation, loneliness, cheating, and shame. And this TED Talk has a whopping 25 million views. And so this is a topic that definitely is of great interest and needs to be opened up here today. Welcome, Maureen. We are so happy to have you with us today.
Oh, thanks. It's awesome to be here with you.
We are just really honored by your presence. And tell us, to get started, Maureen, how did you come to find your passion in this area of expertise?
Well, to be honest with you, it actually came after an incidence of workplace bullying. And fortunately, there was a physician that I had worked with who offered me an opportunity in his clinical practice to help women who experienced leakage of urine. And so I started working with him about 8 to 10 months after I had left that position. And then I started doing some research for another amazing physician called Dr. Stacey Elliott, who did a lot of men's sexual health research. And I realized that these were taboo subjects. Sexuality was a taboo subject. Nobody discussed it. And also leakage of urine was embarrassing. It was associated with loss of dignity to individuals, and those who had leakage of urine issues often had sexual health issues. And because even though we're living in a sexualized world, sex is still taboo. And so I realized that education was important and was really the only clear pathway to helping people to live a better quality of life, and especially have healthier relationships with themselves and others.
So important.
Such a great point that we have progressed in so many different areas, and we talk about so many more things that we even did 2 decades ago. But this is definitely a topic that has not progressed at all. You're right. And I love the fact that you've really committed your career, changed that direction that you were in originally, and really gone after this. It's been absolutely amazing. I mean, maybe you can correct me if I'm wrong, Maureen, but isn't the divorce rate at 50%? And as we continue to move ahead, we want to be decreasing that, not increasing that.
We certainly do. And certainly there are places where the divorce rate is as high as 50%. But, at times it's around 40% typically. Okay. But yes, having issues with your sexuality or sexual health can certainly lead to the breakdown or break up of a marriage. And that can affect children in the marriage as well.
Absolutely.
And it has so many rippling effects to friends and family and at workplaces. And so it's something that we really need to address and take a look at and really take the shame out of it, because there's
Yeah.
often a tremendous amount of shame because of the negative messages or the religious connotation that has been associated with it, or the improper sexual health education, which has been taken on by schools and teachers who may not be equipped to actually provide that education. We really need to put this under healthcare authorities and healthcare institutions, or at least make it a collaborative effort between parents, healthcare institutions, and the schools as well.
Absolutely. Now, I'm really curious about what the most common issues that bring someone to your clinic, both for female and for male, actually.
Well, for women, it's largely painful sex, and
Okay.
that's the result of decreased estrogen in the urogenital tract, and that can lead to another problem, which probably competes with painful sex or vaginal dryness, which is low sexual desire. So they are
Yeah.
all related, and so it depends on the age of the woman. But a woman will often present with low sexual desire. She'll view sex as a chore. She's not been educated that sex is for her as well, that it's mutual as long as it's consenting. And so many women struggle with low sexual desire, but there can be reasons for it. And it's often associated with a medical condition like genitourinary syndrome of menopause, or leakage of urine, vaginal dryness, painful sex. For men, I probably see premature ejaculation as the number one issue. So they have performance issues. And number two would be erectile dysfunction. And both of those are associated with medical conditions. For example, premature ejaculation is typically associated with anxiety, which can also contribute to the demise of the relationship as well. And then erectile dysfunction is associated with cardiovascular disease or heart health. And so these are two, again, sexual health topics that can be embarrassing for people, but may in fact be related to their overall health.
Those are awesome points, feedback, information. That's nothing that I've ever heard before. So that is, for someone listening out there that is struggling with some of these main issues that Maureen has brought up, you bring a lot of awareness to those. So thank you. That's great.
Well, they're so secretive and they're so
Yeah.
taboo, especially around women's sexuality, because there's a double standard for men and women. And oftentimes at perimenopause, which is the years leading up to menopause, the estrogen receptors decrease in the urogenital tract. It can result in vaginal dryness and painful sex, and it can impact the relationship. It can lead to divorce. I've actually seen it because nobody wants to do anything that is going to hurt them. And also, people don't want to do something with another person thinking that they might hurt them. And so there are lots of treatments for vaginal dryness, hormone-free treatments or treatments with hormones that are low dose, localized therapies where that will start to take effect in 2 weeks, optimized in 2 to 3 months. But for vaginal dryness, for example, 75% of women will experience vaginal dryness at some point related to oral contraceptive, pregnancy, postpartum, breastfeeding, perimenopause, menopause, and post, but only 5% are treated. And that's also associated with urinary tract infections. So as you can see, this is all related.
Yeah.
One thing leads to another.
Absolutely.
Can you tell us, Maureen, how do men and women perceive differently the unfoldings of a sexless marriage?
Well, for men, for example, I often hear, my wife doesn't like sex. And so that's not necessarily the case. If I were to continue that sentence, I might say, your wife doesn't like to have sex with you. And that's nothing against that person, but because there may be unresolved issues in the relationship, there may be anger issues, substance use and abuse issues, power and control issues, financial issues, stressors, women being chronically busy, continuing to have the lion's share of the housework, and lack of intimacy in the relationship, lack of that closeness. That, a woman recently told me that she just wanted to tell her husband, and she had 3 kids, she just wanted to tell her husband something about work, and that would bring them closer. It was kind of something that had been occurring at work, and he turned it around and made it all about him and turned it into, well, you should be having sex with me, or you should be having more sex with me. And then it turned into a fight. And oftentimes these little things can actually turn into an argument, and especially if the marriage is sexless. So, men will get extremely frustrated around that. And often women will think, if I never have sex again, it will be too soon, because fatigue is the number one reason for low sexual desire
Mm.
in women. And so today, women are exhausted. The pandemic has added another layer of exhaustion for women. And so, but for women, they will perceive sexless marriage as, all my husband wants is sex. That's all he cares about. He won't help around the house. He won't do anything. I assume all the responsibilities. He sits on the couch, drinks a beer, watches TV, or he's not working, or he's not trying to get back to work, or he just doesn't communicate well, share his feelings, understand me. If we were just closer emotionally, I may be more interested in having sex, but I'm not necessarily sure that I believe that either. so, it's very complex.
What are tools to bridge that emotional gap to then help bond and repair that sexless marriage?
Well, I think one of the most important things is to educate women about sex and sexuality. Men want to have sex with women, and yet men will slut shame women. Women will slut shame other women, and so we have to really educate people to say, sex is for you. Orgasms are important. There's this whole thing that the journey is much better than the destination. It's not true. Many women suffer with lack of experiencing an orgasm. They don't know if they've ever had one, or they've never had one. We call that primary anorgasmia. But that's so satisfying and so soul soothing. And it actually helps with sleep, and it helps with mental acuity, and also helps with mood and feeling good about oneself, and anxiety. And so to educate women that sexuality is important, but also women need to understand that, especially in a long-term relationship, sexual desire doesn't come first. And women will often say, I have no sexual desire. I just have no desire. But then they might actually, be out with girlfriends, and they might, dance with some hot guy, on the dance floor, and realize, hey, they have sexual desire. They may even take that another step forward. And so women need to understand that it's really responsive desire. So, if all else is good in the relationship and with the children and the family, there's no additional stressors, and you accept your partner's advances and you enjoy it, we call that responsive desire. It's a biopsychosocial model developed by Dr. Rosemary Basson in Vancouver, British Columbia, at the BC Center for Sexual Medicine. And so that piece of information resonates with so many women, and they realize, and they think, why didn't I do that last night? That felt good. It was great. I feel better. I'm closer to my partner. And this is actually same-sex marriages or heterosexual unions. It doesn't matter what the relationship is. Low sexual desire can affect anybody. It can also affect men. And I want to make that point very clearly. Men experience low sexual desire as well, and women suffer much more when a man does not want to have sex with her, because the conventional wisdom is all men want is sex. And that's not necessarily true. And there are about 20% of men who experience low sexual desire, compared with 38% of women who experience low sexual desire. But the reasons, aside from menopause and pregnancy, are the same: fatigue, medical illness, medications. So it's very important to know that anybody can experience low sexual desire, but it's also important to know there are treatments.
So what can someone do? If someone's listening right now, any of our listeners out there, and they go, hey, wait a minute. Yeah, that is me. It's been whatever months, it's been weeks. I definitely can classify myself as someone who is suffering from a sexless marriage. Apart from coming to see you in clinic and things, which is great. What can they do kind of starting today to help during this time? I mean, in British Columbia, here we are with going into another month of, things locking down in BC and people spending more time at home and things. How can they flip the script or change habits or do something within their confines of their home today to build that closeness?
Well, first of all, with all due respect, given the pandemic, they can't come and see me in my office right now. It's all virtual visits.
Oh, okay. Yeah.
And that's my virtual health clinic called getcleopatra.com.
Awesome.
And so it's a virtual health clinic for intimate health issues. And many, many people need that privacy and confidentiality, because although I say sex is taboo and we need to open up the conversation, it's still a very private matter for people, and they need to trust. And so I use a HIPAA compliant for privacy and confidentiality platform so that no information can actually be shared. So aside from that, there are many things that women can do and men can do as well. They can tune into my Sunday Night Health show. I talk about these subjects. I have a back to the bedroom segment, and we talk
Awesome.
about sex throughout the program as well. But also really take stock of the relationship. Take a look and look at oneself. How have I contributed to my sexless marriage? Is the important aspect, because we play the blame game. We want to blame the other person. He's so this, she's so that. And typically in former days, when people would come into my clinical practice, I'd let them do that for about 10 minutes, and realizing we only have an hour, I'd have to shift it and say, now pick up the proverbial mirror. Take a look at yourself. Even if a woman is exhausted or a man is exhausted, look at that reason behind the exhaustion. Is it a medical condition? Is it depression? Is it substance use and abuse? Is it fatigue from doing the lion's share of the housework? Are you working outside of the home and inside of the home? And so really taking stock of your own personal responsibility. Otherwise, people will get nowhere from that. That's one thing. Education, very important. Keep in mind that intimacy and sex is a very important aspect of marriage. Marry the right person, which was effectively the tone of my talk. Know who you are marrying. Okay, so they're already married, so we're too late on that. But for those who are not yet married, really, it's important to choose the right person. Is there a history of sexual abuse or unwanted sexual advances or trauma in the person that you have fallen in love with? Are you thinking you can change things or make it better, or it'll just get better after you get married? It will not. I am here to tell you. For people who have had sexual abuse or trauma, it will impact your intimacy for the rest of your life. And so that's something important to know. Have those open conversations. And also take care of your health. Body image is another contributing factor to low sexual desire. If you don't feel good about your own body, you can't do the little dance like you did at the beginning of this podcast. It's because you're not confident in that. And so it's very important to be confident, always take care of yourself. But if you have low sexual desire, take a look at the reasons why. Work to change that today. Have that conversation with your partner that you want to be closer, you want to be intimate, because it can lead to all sorts of unnecessary anger and brawls and upset and ultimately
So
divorce.
So true. Maureen, you really commented on something a little bit earlier that I want to open up that conversation on. You talked about how men perceive a sexless marriage as that their spouse just doesn't like having sex, but that a woman perhaps perceives it very differently because men are inherently known to want sex. And so perhaps do they adopt more feelings of worthiness and lack of value when it is their spouse who doesn't want to have sex with them?
Do men experience that?
Women.
Do women, when their spouse does not, when the male partner doesn't want to have sex with them? Absolutely. That's why I say it is so much more difficult. It's very difficult for a man when when his wife does not want to have sex with him, or his partner doesn't want to have sex with him. Very, very distressing. It can lead to loneliness, embarrassment, shame. However, he's got a support group. There's a lot of men in that hockey room, in that locker room, that are all singing the same song, basically. But for women, it's that much more devastating, because we have this conventional wisdom out there that every man wants sex with any woman there is. And that is definitely not the case either. Men have to be attracted to a woman, but a man can experience low sexual desire. But a woman often thinks, what's wrong with me? I'm not good enough. I'm not pretty enough. I'm not thin enough. I'm not rich enough. I'm not happy enough. I'm not good enough. I'm not doing enough for him. My house isn't clean enough. My kids aren't perfect. My life isn't perfect. What is wrong with me? And it can lead to rumination and tremendous anxiety and distress and sadness and upset and depression. And oftentimes women, because we're kind of fixers, we're kind of the ones who take care of everything in the home, and so a woman is constantly trying, hoping against hope that this will happen. I'm on a Facebook group as a consultant for women who are in sexless marriages, and it's just every day they are saying, again, last night again, I put a lingerie, a beautiful down on, and pumps and strutted in and no response, and it's just, I'm devastated, I'm sad. And so it's horrible for women, for men, sorry. It is that much worse for women, because of this whole societal ideal that all men want is sex.
So for all of our listeners out there, if you are a woman who has experienced these feelings of worthiness and lack of value because of a sexless marriage, I hope you truly hear the insights that Maureen is sharing and seek the education behind it and seek all of these tools and pursue all these tools that we can do. Maureen, I have another question. I found it really
I just wanted to add
Yes.
something, if you don't mind. For women need to remember, and men too, but more so women, it is not about them. When a man experiences low sexual desire and doesn't want to have sex with you, he has an issue that must be resolved. For when women have low sexual desire, it's a little bit more of a couple issue.
Interesting.
Carry on. I didn't mean to interrupt you.
No. That's really insightful. And I remember years ago learning from you that men often cheat in a relationship to stay in that marriage, whereas women cheat perhaps more to get out of that marriage. Can you elaborate a bit more on this?
Sure. It's sort of a very general. Of course,
Yes.
it doesn't apply to, we can't paint everybody with that brush, but marriage and sex are quite different. It is a biological need and a drive for people to have sex, men and women. But the reasons for staying in the marriage can be quite different for men and women. For men, it's security, it's the membership to the golf club, it's the friends, it's the in-laws, it's the company that he works for, perhaps. It's all about looking good, but he has this drive and this desire, as do women. I don't want to say women don't have that or that women don't cheat. But men typically don't want to leave the security of their home, their couch, their TV, the food on the table, everything they've got set up to look great, but they do want to have sex. And so they may find that sex outside of the relationship, but they have little, if any, intention to leave the marriage. They may leave under certain circumstances, for example, if they get caught, because betrayal is one of the most heartbreaking aspects of a relationship. Trust is the foundation of any relationship. So, for example, if they get caught, they typically get caught quite a bit, the ones that come to my practice anyway, because they have no password on their computer, or they shared their password. And also if they may, have a relationship with someone else, but they may continue that on for a year or two. I've seen that. And then that woman gets pregnant. That's another circumstance where a man may leave. He feels he has to leave. So he really wants to stay in the relationship. He really wants to have sex. He really wants to have sex with his wife. Men are happy to have sex with one woman for the rest of their lives. Now, of course, we do have the cheating scoundrels, if you will, that small category where they're just going to cheat. That's just who they are. That's it. And that's a values issue. But for the most part, men do not want to get caught. They do not want to leave. They regret it. They are so sorry afterward. They are embarrassed. They didn't want to leave, but they couldn't communicate with their wife the importance of having sex in their marriage.
I don't know if you'd know this stat, Maureen, but so that people that are in the sexless marriage that we're talking about today are not feeling so alone, do you have a stat as to what percentage of marriages are sexless or anything along those lines, so that people don't feel like they're alone?
About 20%, according to a Time magazine survey that was done, but likely probably more. And that is defined, sexless marriage is defined as sex less than 10 times a year. But say you're having sex 11 times a year. That doesn't make you, that doesn't put you in another, catapult you into another category. Like, oh my God, I'm 11, I'm all good. No.
And is there a specific time, like, is it 1 to 5 years that people start, I know it's when you're newlywed and there's all that, the excitement around and things like that. Quite often you're having more sex at the beginning of your marriage. Is there a stat, as the years go on, the sex becomes less or anything around that?
It certainly does become less. And, but that's why I say again, it's very important who you marry. And I remember talking to a colleague of mine. We were at a conference and he said that his nephew was going out with a nice Jewish girl. And this was a Jewish family, and they were all very happy. And she was going to make a great mom, and she was going to, she had a good job and all the things. She ticked all the boxes, but there was a problem, is that he wasn't sexually attracted to her. He had more chemistry with a non-Jewish girl. And so his advice to his nephew was, marry the woman who is going to be the great mom and the great, but that you're not attracted to, and she's Jewish. And I said to him, you have given the wrong advice here. He really should be marrying the woman that he has chemistry with, that he is explosive with, because if you don't have that at the beginning, this is what leads to lots of problems. It's bad enough if you have it at the beginning, because you're going to lose it after about 2 to 4 years, because there is a hormone in the brain that actually reduces after a couple of years. And that's certainly a biological component there because of reproduction. And so it relates to reproduction. But it's very important to marry the person that you have chemistry with, because when all else fails, if you can meet in the bedroom, things are going to be looking good. You'll be relaxed, have a smile on your face. And so that connection. But as years wear on, women actually report more boredom in the bedroom sexually than men do. As I said, men are happy to have sex with the same person for the rest of their lives. Women become very bored. And I hear that from women. They feel like sex is a chore, it's boring. They may just lie there and think about their list of what they have to do the next day. And so there's so many aspects of that. You have to keep the relationship exciting after 10, 20, 30 years. Keep mystery going, flirt with other people, but just don't carry on. But there's, fantasy is important. And so there are strategies as well to keep that, that sex life hot and spicy.
Great tools, Maureen. Those are
because
fabulous.
Nature's against you.
Yeah,
absolutely.
Fabulous tools.
I love the program that you talked about, and the fact that your consults are all virtual and things right now. So, if you're listening today, if this hits home with you, it doesn't actually matter if you're in BC or not. You can book a call with Maureen, and really get some tools to continue to help you. You can also visit her on some of her resources that she mentioned earlier, such as her Sunday night show. But there is a lot of resources out there for you, but you just, I think, need to have awareness about where to look.
So realize those health benefits, the endless health benefits, both physical and mental. Get educated, take accountability for your role in your sexless marriage. Shift that view from the blame back to what we can change within ourselves. Open up the conversation with your partner, address body image issues, and take care of your body image, and burst the underlying anger that can be there within marriages. Thank you, Maureen. We are just so honored.
I wanted to add, because you keep saying the word tools. So one of the greatest tools.
We should have opened up on this, of course. Yes, go.
The best tool. One of the best tools for women is a device called the Womanizer. And so when I first heard about the Womanizer, I thought, oh, here they go again, really taking over. Womanizer is considered a cad, and it actually, is a painful term. So we've reclaimed that. And the Womanizer is actually a clitoral stimulation device for women to experience orgasm. And, you can have sex with yourself, or you can have sex with someone else. And there's no shame in bringing sex toys into the bedroom. But it's very important for a woman to explore, get to know her body, experience orgasm. And I prescribe the Womanizer to my patients. I've been doing it for about 3 years. And especially for women who have primary anorgasmia, who have never experienced an orgasm, or women who don't know if they've experienced an orgasm, because the Womanizer never disappoints. And a woman will experience, because it actually knows the right spot, which can be a problem in a lot of relationships, because a lot of women complain that their partner doesn't know the right spot. And so it actually finds the right spot, and it stays there, and in a matter of minutes. And a lot of women say it takes upwards of 20 minutes for them to experience an orgasm. But with the Womanizer, which has 8 settings and delivers a powerful stimulation component, a woman can experience orgasm within seconds to minutes, actually. And so it's a great tool, great device. So I'm happy to give your listeners, maybe they mention the word Erica and the name Erica, and they can have $30 off.
That's amazing.
Maureen, can you just share with us again where people can find you?
Sure, they can go to my website, maureenmcgrath.com, or to my getcleopatra.com if they are interested in learning more about intimate health.
Maureen, on a leaving note, can you tell us how many times a day, how many times a week, how many times a month? What's your recommendation for how many times we should orgasm?
Oh, well, that's every day, like 5 times a day. No, I'm just kidding. It's just an important part of health. And
Yes.
so whatever works for somebody, that's their number. I had a surgeon who was a patient, and she was getting very stressed going into the operating room, and she was about to go on antidepressants. Now, I'm not saying for people who need antidepressants, the Womanizer is going to work for you, but she did find that just before her surgery, she used the Womanizer, she was relaxed, and she actually was able to ward off having to go on an antidepressant. So experiencing orgasm, being in love with yourself, being accepting of yourself, understanding that sexuality is important for you is, half the battle. Oftentimes, Erica, I get the question, how often should couples have sex? And so, it's not something you want to go more than a week, to be honest with you.
Okay.
If I were to say
Yeah,
twice
that's
a week,
good
depending
advice.
on the age, but you know what, if somebody in your if both of you in a relationship don't want to have sex, it's no problem. You don't have a problem. That is absolutely fine as well. But, a couple of times a week, think about spending time alone, just thinking about, I call it afternoon delight for a lot of women. It's very important. And I think whatever floats your boat, is good for you.
I love that. So
Fantastic.
important.
Thank you.
Risers, we hope you have loved today's show with Maureen McGrath, an RN who serves as a sexual health and incontinence expert, who is the founder of getcleopatra.com and the host of the CKNW Sunday Night Health Show. Seek out her resources, be educated, take your accountability, and rise today. Thank you for being with us today.
Thanks for joining, everyone. I hope you guys have a wonderful day. I hope that you gain inspiration from this and really, take a look at your relationship. Take a look at how you can, contribute to your own relationship's health. Thanks for joining.
All the best. Rise today.
It's gonna be a good day.
Thanks so much for joining us today. Take this inspiration forward. Learn more at risetoday.com/podcast. And please do help us in our mission to spread hope, inspiration, and positivity by encouraging those in your circle to join us and to tune in for our next show of inspiration coming soon. Please contact us if you have a powerful story to share with us to inspire the world. Until next time, get out there and rise today.